Good morning. My name is Dr. Marianne Marshall-Gibson, and this is our patient for today to demonstrate equine acupuncture. His name is Quincy. He's a 10-year-old quarter horse gelding, and he has never had acupuncture before. So we're going to go through what I do for my initial assessment for a patient that is getting acupuncture for the first time. So a little bit about acupuncture. It's been around for centuries. First came around with the Chinese. Basically, it's from the traditional Chinese medicine, and what they noticed a long time ago was that there seemed to be some sort of connection throughout the human body and as well as other animal bodies where they could pick certain points and they could have an effect systemically and have an effect to treat diseases or other ailments of the body, whether or not it's arthritis or allergies, things like that. And what we've learned today is adapting that to modern medicine. Those channels that seem to correlate with the energy actually follow the nervous system. So the nervous system is one of the most important systems in the body. It controls everything. It controls our movement, it controls our thoughts, it controls our ability to fight disease, and a lot of other things that are important to us as beings. So, as a veterinarian, I like to use acupuncture as a holistic approach to treating my patients for anything that might be bothering them and preventing them from leading fully functional lives. So, just to start out with Quincy here, I start out with a basic exam, and what I do is I take a blunt object, such as a needle cap, and I will run along the meridians and look for certain responses or reactions as I run along the meridians that will indicate any areas where he might be having trouble, either with his musculoskeletal system, his immune system, things like that, and then we'll kind of target those points. Because this is Quincy's first experience with this, we kind of go slow and see how they respond to our needles at first. And so we might not get a lot of needles in today, but we want to make this an enjoyable experience so we can continue to do this treatment. And so first thing I do is I'll start up here by his ears, and I'll just start along the different meridians. So some of the meridians up here, since they're adapted from human medicine, the points don't always correlate with the animal patient. So the names like gallbladder don't really make sense in the horse since they don't have a gallbladder, but they do correlate with the nerves that run there. So I will go down, and the triple heater and bladder line up top kind of run together in the horse. And then I'll go along and do the gallbladder line, see if I get any response, and then the large intestine line. And overall, that's pretty good. He's starting to tense up just a little bit here, and that actually corresponds with stomach 10, which can indicate a little bit of muscle or shoulder soreness or foot soreness. And then I'll go along his body. And I'm not putting very much pressure, just about 2 to 3 pounds of pressure. A little bit of muscle soreness along the bladder line. This area can also correspond with some GI issues, so if I have a medical colic or something like that, I can try to target these points up here to get their GI system moving a little bit better. And then I also look at his hip points. Good boy. Another area that they can have some issues too, you can get a response to gallbladder 24 here, sometimes if they have a little bit of GI discomfort or ulcers. Overall, he seems to scan pretty well, mostly just a little bit of muscle soreness up here and through his glutes. He is a working horse, so that's not unexpected, pretty typical for horses that are working pretty hard. What do you think, buddy? I'm just going to do a quick scan on the other side. So pretty symmetrical response. A little bit more in his gluteals back here and his hip points. Good boy, Quincy. So, based on what I found, I will pick some points to put some needles into. There are lots of different types of needles you can use. The ones that I'm going to choose for him today have a little bit of a silicone coating, and basically what that does is it dulls the sensation that they feel as it's going in. So you still get a very potent response by stimulating the muscles and the skin that it's going through, but you won't shock their system quite as much if you had an uncoated needle. So, first one that I'm going to do is actually an anti-anxiety point. This is one that I usually start with all my patients, Governor Vessel 14. And a lot of times I've had patients fall asleep just because they carry so much tension up in their nuchal ligament up here that they'll relax so much they'll fall right asleep and let me do the rest of my treatment. Huh, buddy? Good boy.
So I know that you have gone to school, and obviously you're a veterinarian, but you did extra training in chiropractic and acupuncture. And so from your website I found out that you have done a lengthy training in acupuncture. Can you talk a little bit about how people would go about finding an acupuncturist, what they need to look for as far as training or hours spent doing it or experience? Or
Sure. So the qualifications vary a little bit by state. In the state of Colorado, they do require that you are a veterinarian that has been trained specifically in acupuncture. So what that means is you've gone to a school and you have gone through coursework to actually gain a certification. So typically, a veterinarian that has been trained in acupuncture will have some form of letters after their name, either CVA or CVMA, indicating that they have gone through a trained coursework where they're required to go through testing and things like that. So it's very important for me when I'm going over, horses as a veterinarian, and I hear that the horse has been worked on by an acupuncturist, to know who that person is, because a lot of times that can be key. What they know can help me in my diagnosis. So if you have someone who has been properly trained, they will be able to key in on certain things like this point sore, and that can relate to, like Allie, her allergies and things like that. So that brings to my attention, okay, there's certain medications I should be careful in using when I'm treating this horse. So when you're looking for an acupuncturist, try to go to one of the school's websites and try to find an alumni of one of those schools. So the Chi Institute in Florida is one. There's one in Colorado as well. I went through Colorado State University's training program. So you can always contact those programs and ask for alumni in that area.
Right, because just because a vet does acupuncture doesn't mean that they trained to do acupuncture. Unfortunately, there's some people out there who are placing needles without maybe having a formal education about it.
Right, exactly. Yeah. So definitely contact those schools. They'll be happy to help you out and find the right acupuncturist for your horse.